Well, thanks so much, everyone, for those who are joining online. We're really excited to have you all. My name is Jason Tandaviviena, and I'm a research associate with the policing program at the Vera Institute of Justice. I'm really excited to be moderating the session today on the topic of race equity, crisis response, and pre-arrest diversion, addressing disparities at the intersection of policing and behavioral health. So I'm joined today from representatives from 3 really incredible programs and initiatives that you'll get to hear more about shortly. Folks on the screen that you'll see, that's Denise White, the Director of Diversion Services with Atlanta's Policing Alternatives and Diversion Initiative, also known as PAD. Vinny Cervantes, Organizing Director with the Denver Alliance for Street Health Response, also known as Dasher, and Tremaine Clayton, Community Health Assessment Team Coordinator with Portland Fire and Rescue and the new Portland Street Response Program. So our 50 minutes is going to go by quickly, so I want to let you all know how we plan to use the time. I'm going to take a few more minutes to share some background info on the Vera Institute's recent and upcoming work around crisis response alternatives and race equity and inclusion. Then you'll get to hear from Denise, Vinny, and Tremaine about each of their programs, initiatives, and advocacy. And we're hoping to have about 5 to 10 minutes or so for some questions and discussion with all our speakers at the end. We know folks are split between Zoom and Whova, but we'll keep an eye on the Zoom Q&A function as well as Whova, and we'll do our best to see what comes up for folks towards the end. So before I move on, I wanted to take a second to acknowledge the land where I'm calling in from today. I'm currently located in Brooklyn, New York, along with some of my other colleagues from the Vera Institutes, and this is the traditional territory of the Lenape people. Especially given today's topic, the context of where we're working is of critical importance in terms of history, but also present day issues. So I'm really looking forward to hearing more about that local context from my fellow speakers today. I'm also glad that even though I'm sure we've all been on far too many Zoom meetings today, this year, I'm glad we're all able to convene virtually for LEPH, so big thanks to the organizers for that. So the Vera Institute of Justice is a nonprofit organization that works nationally across the United States to end criminalization and mass incarceration. We use our research, technical assistance, and advocacy expertise to support solutions across many issues and areas of the criminal, legal, and immigration systems. For our policing program, our current goals are to shrink the footprint of American policing and to advance racial equity. One of the strategies that we use is to analyze what police currently do and to identify and support efforts to build out alternative community-based solutions for public safety. And we do this by focusing on analyzing where disparities, bias, and inequities persist. So one of the key areas as we work towards these goals, one of the key areas that we're focused on is the intersection between policing and behavioral health. You're just seeing the landing page or homepage for our team's recent report on behavioral health crisis alternatives, shifting from police to community responses. So with more than 240 million 911 calls made each year, in many communities, police are the default first responders and outreach workers for a wide range of social issues, from mental illness to substance use to homelessness. We see the dire shortcomings of this approach in the disproportionate number of people killed by police every year in moments of crisis, and the numbers of people with mental illness and substance use disorders held in our jails and prisons. Even when police officers have skills and experience around de-escalation and or are empowered to divert from arrest and incarceration, the mere presence of uniformed armed officers with police vehicles can exacerbate and escalate crisis situations. This is particularly salient for Black people, Indigenous people, and other people of color, and other groups that have been negatively impacted by policing. So part of creating more equitable services and responses can include reducing the role of police in responding to people in crisis, but also building up more comprehensive health services and community supports that are accessible to communities of color and other groups for before and after moments of crisis. I won't spend too much time on our report, but just for those who are interested, we have described different models that currently exist for responding to behavioral health crises with varying levels of police involvement. And we also researched local efforts to shift from police-led to community-based approaches This included case studies from Phoenix, Arizona, Eugene, Oregon, and Olympia, Washington, of efforts to divert 911 calls, dispatch different types of crisis response responders, and implement peer outreach and navigation programs. We are really excited for the next phase of our work on crisis response alternatives and what we're seeing from others in the field. So over the next year, with the support of the NFL Foundation, our team at Vera will be exploring how crisis response programs can center race, equity, and inclusion in planning, implementation, and evaluation. We're seeing the emergence and expansion of new models and programs across the country, many of which have been tied closely to calls for racial justice over the past year. These programs and initiatives have great potential to improve public safety and public health, but we know that equity is never guaranteed. There are always implicit and explicit priorities and decisions baked into different programs and initiatives. I'm just reflecting on what we've seen with equity issues with the rollout of the COVID-19 vaccine recently. So it's going to take intention, resources, planning, and adaptation. And importantly, this isn't just about police. There are a wide variety of other stakeholders that also contribute to systemic inequities. And this isn't just about the point of crisis, 911 call, or interactions with first responders. Inequities may be upstream and downstream of the crisis. So we're thinking about opportunities in behavioral healthcare, housing, and other systems. So as mentioned, over the next year, we'll be interviewing national and local stakeholders, connecting with local programs and initiatives, and hosting a convening later this year to develop practical guidance and recommendations to share with the field. Especially for those of you are here for LEPH. We're very much in learning mode, so please get in touch if this is an area of interest or something that you're working on. So just to set up Denise, Vinny, and Tremaine, we know that there are important opportunities to address disparities and advance equity at many different stages of program implementation and expansion. This may include who has a seat and a voice at the table when programs and initiatives are being designed, what types of data and metrics are being tracked, and who has access to that data and decision-making power around program adaptation and expansion. This may relate to planning for more equitable access to alternative crisis responders and diversion services across geographic location, different dimensions of race, class, gender, disability, and other factors. Are the on-scene responders and supports trusted by communities of color and other groups that have had negative experiences with both police and behavioral healthcare? And what changes need to happen with 911 or alternative numbers to improve access for different groups? So this is all easier said than done. I'm excited for you to hear from Denise, Vinny, and Tremaine about some of their successes, challenges, and lessons learned from their hard work in their communities. So Denise, you're up. And feel free to prompt me when you're ready to move on your slides.
Thank you, Jason. Next slide, please. Next slide. So my name is Denise White, and I'm the Director of Diversion Services with PAD, and PAD just stands for Policing Alternatives and Diversion Initiative. And we're a nonprofit organization that has really two core components to our program. The first one is the LEAD model, Law Enforcement Assisted Diversions. And we work with the Atlanta Police Department and our Transit Police Department called MARTA, where, as you all may know, if an officer comes in contact with someone who is potentially committing an offense related to problematic substance use, unmet mental health needs, or extreme poverty, that officer can actually divert that person to PAD instead of charging them. Now, when we began in 2017, we had a slight barrier to our program. And so some of the community members that we would interact with would just say, hey, can I just contact you all instead of the police? I mean, sometimes officers weren't aware of the LEAD model, or it's their discretion whether or not they want to provide LEAD as a service. And at that time, we didn't really have the option of community members contacting us directly. So In January of this year, we were happy to begin implementing community referrals through our 311 non-emergency line. Next slide, please. All right, so basically in July through October, we had this community design process where we wanted people at the table with lived experience, people who were impacted by policing and incarceration, and also community members as well. We just wanted to come together to say, hey, you know, how can we implement this community referral process? So from July through October, we basically had working groups and listening sessions to really dive deep to see, you know, what can our team respond to, what kind of partners do we need to bring to the table, things of that nature. So from July through October, it was just definitely a working session, and we definitely got really into the weeds and trying to figure out the best practices for implementing this model. And then from November through December, we actually executed the City of Atlanta MOU with PAD. So we, had this agreement basically saying, what PAD is going to do, what the City of Atlanta 311, what their duties are, and how we're going to work together. So then we had to meet with the City Council to let them know about our expansion plans. And then we had to orient the 311 agents with basically how to answer the calls from community members. And now what we're doing is just educating the community about 311, because a lot of community members don't know about calling 311, especially since, a lot of messaging has been around, if you see something, say something, call 911. Next slide, please. All right, so we actually studied 3.5 years of 911 call data just to identify what types of calls 911, what type of calls they were receiving. And then we also surveyed our City of Atlanta residents just to identify, okay, what kind of issues do you all see that's related to quality of life concerns? When would you call 311 instead of 911? And then we also had these listening sessions where we brought in community members, community activists, and we also had other organizations just to come. And we really, got into the thick of it as far as, just identifying, how can Atlanta be safer in utilizing the 311 non-emergency line. And then at the very end, we just designed protocols for implementing the 311 process, and also just, figuring out the challenges that could occur, and also what's working well. I mean, we literally just implemented this in January, so we're still, figuring a lot of the kinks out. Next slide, please. And these are some of the co-hosting organizations for our community listening sessions. And one particular question that we asked, we wanted to know from our community members if, would you feel safer if you called 311 for concerns related to mental health, substance use, and poverty? And 98% of the respondents said yes, their community would feel safer if our team went out to the location to respond to those quality of life issues. Next slide, please. All right, and then we just wanted to know what kind of services should we, provide to individuals who have a quality of life concerns. And 99% of the community members responded and said that they, wanted the person to at least be given a resource for support. And 96% of the respondents thought that, the team should arrive quickly So when our team arrives to the scene, there are two types of basically requests that we get. We get the urgent immediate response request, and then we also get our outreach request. So the immediate requests, those are for individuals who are at risk for getting arrested. So if there's an emergency where someone perhaps is not wearing any clothing, perhaps someone could be urinating in public, anything like that, where they're at risk for getting arrested, we deem that type of request to be urgent. And so our team will go out to the scene within 30 minutes to respond to requests, immediate requests. But then we have other requests that are called outreach requests. And those requests are really for individuals who may just be chronically experiencing homelessness. So we can actually arrive to the location within 72 hours. I mean, we would love to arrive at the scene within 30 minutes for all of our requests. Unfortunately, we don't have the capacity to do that at this moment. So next slide, please. So we also wanted to know what types of issues would our community contact us on. So definitely yelling and causing a public disturbance. That was very high on the list. Someone living in an abandoned building. And towards the end, towards the bottom, if you see, someone asking for money on the street, only 29% of people said that they would contact, us to come to the scene to help that individual, even though, panhandling is an ordinance in the city of Atlanta and you can get arrested for that. But so we just really learn from our, community members that, if someone asks for money, if they don't have it, they just say, thank you, and that's it. Like they didn't understand why, law enforcement would be called for that type of issue. All right, next slide, please. All right, so what happens during our community referral process? So the first thing is our hours are from 7 a.m. to 7 p.m. Monday through Friday, and those hours are in alignment with our 311 system. We've gotten, some feedback from our community members, what happens if there's a quality of life issue that occurs outside of that time frame, and we basically just, let them know, hey, this is why our partners are really important. Because again, we are a small nonprofit and we don't have the capacity to be a 24-hour center. So after a community member calls the 311 line, the 311 agent will just ask a series of screening questions just to determine whether or not this is a good fit for PAD. The agent will ask, is this an emergency? Is the person in danger? Is the person under 18? And if they answer yes to any of those questions, then they will be directed to 911 or other resources. And also, it's important to note that we didn't just expand to the entire city of Atlanta during this community referral process. We are actually in different zones. We are staggering our community referral process. Right now, we are in 3 zones, and we're going to be in our next zone next month, and then eventually in June we'll be in all of the city of Atlanta police zones. So again, going back to a capacity issue, we felt like because we're such a small organization, we're not able to respond just immediately to all the requests in the city of Atlanta. So that's why we're going to stagger our implementation process. So after the agent asks the caller those screening questions, then they will just send us an email, our referral coordinator email, and then the referral coordinator will dispatch our harm reduction team. And again, they will go to the scene within 30 minutes or within 72 hours, depending on what type of request it is. All right, next slide, please. All right, so this is just our harm reduction team. Next slide. All right, so our harm reduction team gets dispatched to the location. They identify the person's immediate needs, and then they assess the individual on whether or not that person is going to receive 30-day case management or long-term case management. So for long-term case management, our mission is to make sure that people stay out of the criminal legal system. So if we have participants with open cases, then that individual will receive long-term case management. And those individuals who receive 30-day case management, more than likely, typically they won't have any open cases. And so we will give them the 30-day case management and then refer them out to another case management agency. And of course, if the individual consents, they become PAD participants. And we are a completely consent-based program. So if an individual does not want our support at that moment, even if a community member calls us and we arrive at the scene and that person says, no, thank you, I do not want your help, we respect that person's wishes. And our referral coordinators, they always follow up with our callers just to let them know, what happened at the location, because we feel like that's providing great customer service to let that caller know, basically the person was found or the person declined care, or we're in the process of working with them. All right, next slide. All right, and this is just a picture of one of our care navigators. And once that person receives that case management, our care navigator will just identify their longer needs. So, our harm reduction team, they identify the immediate needs, and then the care navigator identifies, for instance, obtaining a birth certificate or an ID, things of that nature. And so, our harm reduction team goes out to the location immediately, but then the care navigator is there to provide the longer support. Next slide. And that's all I had. So I'm happy to answer any questions.
Cool. Thanks so much, Denise. So we'll get to some questions at the end. Just wanted to thank you for sharing the story of PAD. I've really appreciated hearing the recent developments, how they've been responsive to community needs, as well as knowing more about the origins of PAD. Vinny, you're up next. I'm gonna stop screen sharing for a second. So I know you don't need slides, but take it away. Thanks.
Yeah, thank you. My name is Vinny Cervantes with Dasher, Denver Alliance for Street Health Response, and we've been around since 2018 with the explicit goal to create and support community-based responses to conflict and crisis, which includes the STAR program, which was launched in Denver last year on June 1st. But some history around the launch of the STAR program and why we decided to kind of approach this idea was a lot of different situations that had happened in Denver around how we've treated our unhoused community, how Black and brown folks have experienced the criminal justice system, and how we've really invested so many resources into a way to approach issues like mental health crisis, substance use issues, and homelessness with solutions that are not working, frankly, for our communities, especially those most impacted by those issues. And so I have been involved in criminal justice reform prior to that with regards to trying to do work around the use of force policy, independent oversight, trying to influence and hold accountable the district attorney's office. But none of that felt like it was really moving in a direction that felt tangible to us, or at least to me. And I felt more invested in looking towards reimagining our approach to public health and safety crises in a way where we're not using the criminal justice system as this catch-all solution. And so in 2017, I learned about the CAHOOTS program, Crisis Assistance Helping Out on the Streets, which is included in the VERA report in Eugene, Oregon. And that program really appealed to me and a lot of the other folks in the community, especially with the concept that it uses community responders to effectively respond to those issues of mental health crisis, substance use issues, and homelessness. And in doing so, not only have this really effective, really more treatment-focused approach to those issues, but also save their city money overall to the tune of about $8.7 million per year. And it's been around for 30 years, which ensures that for us, it was something that wasn't just kind of a flash in the pan program. It's actually been around for quite a while and could greatly influence how we approached crisis in Denver. So in 2018, we built a coalition around different organizations and different individuals who are both impacted by the criminal justice system or by the issues that I've mentioned already, or who have lived experience with those issues, as well as community advocates and different types of organizations that in our mind served some kind of role in this kind of alternatives to policing and jail, and we're already doing some measure of that work. And so when we came together, we initially were kind of under the banner of an organization called Servicios de la Raza. But as we continued to work on this idea of bringing a cahoots type model to Denver, we decided that it was enough work that needed its own organization. And so that kind of coalition of different groups and individuals became what is now Dasher, which was founded in 2018. It became kind of its own organization that focused on this kind of idea of bringing cahoots to Denver. But we also expanded the work that we're doing to include things that happen after somebody who's been arrested and after they've been charged, and how we avoid that person going to jail or facing punitive measures in the criminal justice system, which helped inform some of our work around restorative justice and restorative practices in Denver and beyond. We've also decided to focus on more upstream issues, how homelessness and housing and food insecurity and education and employment, how those issues have formed downstream issues like violence and addiction and crime, and how we focused also on really ensuring a level of basic human needs as a component of public safety, or at least reducing crime and reducing violence in our communities. But as we continue to work around the STAR program, we visited Eugene with a delegation from Denver in 2019. And when really visiting their program, the biggest thing that we learned, or at least that I learned, was not only the efficiency and the effectiveness of their response mechanism, which is the responders and the van that they use, but also the network and infrastructure of services that they include that ensure that they have somewhere to bring people and that they can actually connect people with services and follow up treatment. And so that was something that really spoke to the success of that program, at least to me. And so when we came back from Eugene to Denver, we decided we formed a work group along with the Denver Police Department. Actually, they convened the work group, and we had been working with a bunch of different city level folks and people that were representing the administrative side of Denver, as well as community folks, to really envision what this program looks like for Denver, taking into account that Eugene is very different from our city. It's much smaller, it's much less diverse than we are, and we have a much more kind of urban setting than Eugene does. And so really taking into account the size and the composition of our communities here in Denver, we did a lot to try to think about what this kind of program could look like. And that work group resulted in the launch of STAR on June 1st, 2020, which is last year. The pilot program for STAR, Support Team Assisted Response, the responders on that van include a paramedic from Denver Health and a clinician from Mental Health Center of Denver. And that was in its pilot phase. So it's still not certain that that's going to be the team moving forward. But that pilot was meant to be a 6 to 12 month pilot, with mostly focused on data collection and evaluation for how this program could be truly effective in our city, and how it could, and what gaps exist in our city to really fill in those follow-up services and infrastructure for treatment and support. And so the first 6 months has already passed, and we released a report that really named the fact that the program has responded to over 700 calls. Not one of those incidents have resulted in arrest, and not one of them have resulted in needing police as a backup or for escalation, which has been the goal. That's what we set out to hope to achieve with this program. Also, the biggest single issue that STAR program responded to was the issue of trespassing as related to homelessness. We have policies in our city that criminalize homelessness, but we also have a lot of encampments, a lot of unhoused folks that are on the street. And so, from Dasher's perspective, we knew that's one of the reasons why we wanted this alternative, because, one of the situations that Denver has become known for, at least with regards to violence that's been experienced through policing in the criminal justice system, was a man, Michael Marshall, who was a Black man, unhoused, had mental health issues. And he experienced a schizophrenic episode in 2015 when he lost his Bible. And when the police showed up, they arrested him for trespassing and brought him to the jail, where he was later killed. And so this is just one incident that we know that we don't want to have police immediately respond to crises like that. And in the way that STAR has already had an impact in our communities, that is the single biggest issue that they've responded to, is trespassing and connecting it to homelessness and mental health crises. The second biggest response that they've shown up for are wellness checks. And overall, it's been a program that has, really been a proof of concept of what we wanted, but I think there's still so much more in terms of how it can grow and how it can better serve our community, better represent our community. And so I believe it's in its 8th or 9th month at this point, and it will still go as a pilot until, I believe, June. But it's in a really weird stage right now because it initially lived under the Department of Safety with the police department as the STAR program in the pilot phase, but the city has since approved and expanded the program and has moved it to Denver Department of Health and Environment. So it's become a public health kind of based program where it's received now $1.3 million for expansion. It initially was started with a $200,000 grant from the Caring for Denver Foundation, an initiative passed in 2018 to fund mental health services through a sales tax. Denver hopes that the Caring for Denver Foundation will match the city investment to make a total of $3 million for the expanded program. So, on one hand, it's a success that it's going from $200,000 to hopefully $3 million in 2021, but it's also in a point of transition where they have not released the RFP yet to really form who's going to be on that ban and running the program long-term 2021 and moving forward. So it's in a really weird situation right now where it's kind of living in two places at once and in different forms in different places. But it's still something that is proving a lot of hope for Denver in terms of having a different response, in terms of reimagining the way that we approach these issues in our communities. But I would again say that there are some gaps. When Denver launched this program, when Dasher was part of the work group, there was some hesitation because it wasn't quite the program that we envisioned. It's a significant degree towards what we want, but it's not exactly what we want. And one of the indicators of that is that through the data that I mentioned earlier, that data report after the first 6 months, one of the biggest glaring gaps was that about 30% of the people that they're contacting are not being recorded or documented with regards to racial or ethnic identity. And for me, that's really important, and especially considering, really being accountable, being responsible to the communities that are most impacted, thinking about equity and diversity. For my community, Latinos, it's not always the case that we're documented as anything other than white when we're interacting with the criminal justice system and Denver police. And so we don't even know the full impact on Latino and Indigenous communities here in Denver because of that dynamic. And so I really struggle to believe that we're really serving or really understanding the impact of the STAR program, knowing that we have about 30% of the people that they're interacting with that we don't know the racial or ethnic identity. And so for me, I believe that makes a difference with regards to who's actually responding to the calls. We have, frankly, responders that are all white. And for a city like Denver with large Black, Brown, Indigenous, and POC populations, that's something that is, I don't think fully representing our community, fully serving our community. And it's a change that we are definitely pushing for as an organization that is now the community facilitator since last summer. Another gap I would say is that we're serving a very small part of Denver right now. And as Denver police have tried to measure the full impact of this program, they have said that this program, if expanded to the full city, can maybe respond to about 3% of the 911 calls in Denver. For us, that's not nearly what we wanted to see. The program in Eugene takes about 17% of their calls for 911. That's almost 1/5 of their calls with $2 million budget out of the $100 million overall public safety budget. In Denver, we want to see close to that 20%, but we believe that part of that is influenced by the fact that we also have a co-responder program, which is the program that pairs the clinician with the police officer that goes out. So we actually have, a pretty interesting spectrum of services that people can be contacted with in Denver if they're in a crisis. But we also think that other program, the co-responder program, is influencing how truly effective the STAR program could be or be projected to impact in our communities. So that's kind of what the STAR program has been so far. And then I would also say that we're working with other cities. We're working with about 10 different cities here in Colorado. We were able to approve unanimously a program in Aurora last year, Aurora, Colorado, which has become nationally known because of Elijah McClain's case in 2019, who was a young Black man who was killed while he was walking home. Just a really horrible incident that the program in Aurora, will hopefully be some kind of alternative for people when they call 911. I also want to note, because I didn't mention it earlier, but when people are able to get to STAR, they do so by calling 911 and the dispatchers make that decision. They have their own decision tree with regards to what kind of situations get traditional policing models, what kind of situation gets the co-responder versus STAR. And so people can reach the STAR program through 911. There's also another number, 720-913-STAR, that if you call that, it directs you to 911 as well, but it flags it as a call that you're looking for the STAR program. So that's how people access it in Denver. The other things that I would note in terms of equity and diversity and accountability to the community is that we have a lot of people that are excited about the STAR program. We have elected officials and city leaders and other people that are just really excited. And especially, since the movements last year around creating change and wanting, demanding some kind of alternatives, there's a lot of community members and a lot of momentum around creating alternatives and reimagining how we approach the situations in our communities with regards to safety and crisis. But at the same time, a lot of these entities or individuals are not actually working with the people that are doing the work. We had a piece of state legislation that was introduced recently that completely left out the communities actually working on this kind of program. And it sought to fund programs like STAR and the one in Aurora, but the way that they structured it wouldn't have actually funded either program or couldn't support either program. And so there's a real, gap in the way that elected officials, both local, state, and even federal, and how other community leaders or local leaders are perceiving this program and how they're looking to support it while leaving those who are working on it completely out of the conversation. We had a task force that was stood up last year called the Reimagining Police Task Force. That too left a lot of community members off and frankly replicated a lot of the work that community members were doing. And so those are going to be issues that we will continue to have to confront in Denver and in Colorado, and frankly around the country as we talk to other cities as they're trying to stand up these programs and how they're trying to do so without the communities and groups that are most impacted and have been doing the work. So I'm also happy to answer questions, but that's kind of the general overview of STAR and Dasher's work and what we're hoping for the future of it. Thank you.
Thanks so much, Vinny. I'm really glad to have you representing Dasher and just the work that's going on in Denver right now. And just wanted to echo that point. I think a lot of us have learned from Cahoots and their experience over many years, but we also are seeing, how complicated it gets in different places of different sizes with different racial and ethnic diversity. But I just appreciated all the points that you laid out there. For folks who, just to note that feel free to leave questions for Vinny in the Q&A, and we'll try and get to some of those or answer them as Denise is doing now. Tremaine, looking forward for you to share some of the story, the most recent rollout of Portland Street Response. Go for it.
Thank you. Thanks for having me here. Hello, everyone. I'm Tremaine Clayton. I use he, they pronouns, and I'm with Portland Fire and Rescue. I'm the chat coordinator for Portland Street Response, and our chat team, which stands for Community Healthcare Assessment Team, that's kind of the origins of the Street Response program. In 2016, our pilot program for the chat team was partnered with Multnomah County EMS office, and they have their Tri-County 911 program, where they look at the EMS system, counting the number of times first responders are sent to an individual residence and or transported to the emergency department. And the goal there is to understand the underlying causes that they're reporting for 911 and seeing if there's a more appropriate response or treatment plan other than the 911 system, such as primary care or another appropriate specialist. The Tri-County program, I believe they started in 2013, and they were focusing on dispatch calls through our third-party ambulance company providers. And our 2016 pilot was looking actually at the the fire response statistics, given that not all of our fire and EMS patients always overlapped. What I was planning to do here is just add some links into the chat just to discuss what I'm talking about. So I just added a little history on the Tri-County 911 program there for you. I took over the chat team, a team of one at the time, back in 2017. And one of the first things that I was noting was the fact that my houseless individual caseload was going up with really no way to follow up. Our incident system, given that it was tracking addresses for those without a home, didn't have a follow-up address. So trying to find a John Doe downtown at 5th and Main, I just didn't know how to do it. So what I started to do was asking crews, once they've identified someone as a high utilizer, if they can call me in real time, and I would try to meet them at the scene and or find them at the emergency department, so that at least we can work with the hospital for discharge planning to try to keep better tabs to make sure we could find somebody if we did have resources come available for them. While I was working in that capacity, I found myself at Street Roots. That's a local nonprofit newspaper, and they really do give a voice to those experiencing homelessness, so many opportunities, and really a chance for folks to kind of get back on their feet, and having an address where we can get them resources and supplies and other things that they may need. And when I found myself there, it just happened to be about the time that the Oregonian had released a study that found just over 50% of the arrests that from our local police department involve those people experiencing homelessness. I'm going to go ahead and throw another link there. That's from the Oregonian. Sorry, I'm trying to multitask with it's not going to paste. We'll get it. But yeah, so that was kind of the issue that was going on. So when I was at Street Roots, I was talking with one of the reporters, Emily Green, and we were just kind of discussing, kind of the structure of the Fire Bureau and the chat program and what that really looked like. And she actually brought up the Cahoots model and asked if I had any familiarity with it. And it turned out I do. I was a volunteer, or still am a volunteer, with Whitebird, which is the parent organization for Cahoots, and I would do event medicine or festival medicine with them. But that same model where we partnered a medic with a crisis worker, and the two of us would go out into the events to help anybody that was anywhere from blisters on their feet, dehydration, or if they decide to try some medicinal experimentation, if you will, at those festivals. If they were having a hard time, we basically would provide that safe space for them so they wouldn't be a harm to themselves or to others while they're going through that substance process. Trying to be politically correct there. So, but that's kind of how I became familiar with that model. And so when Emily was asking about the paramedic crisis worker possibilities of having that within our Fire Bureau, I definitely thought that was something that we could do. Just how does that get implemented, given that we're a government agency, and the Cahoots model being that third party provider, and the fact that they were really partnered with the police, we just kind of didn't really see that being a fit initially. But Emily had already been going through and talking with the dispatch systems, police, other agencies, and she put together a report that really defined what street response could look like. And I would really give the credit to Emily Green for her reporting to really make street response what it is in terms of the concept coming to light. When she put out that report, the goal really was to reduce police response to calls for services involving people experiencing homelessness. And then that also started to kind of squeak over into those experiencing behavioral health crisis in public spaces as well. Again, police having jail or being their option, or the ambulance service giving the emergency department being really the only two places. If there was a way to treat somebody, finding them where they're at and finding a way to divert their jail or emergency department trip, that's really what we were trying to do. And we really felt that the Cahoots model was a way to do that. When we were building this program, we really did want to capture the voice of the community served. And so we worked with Portland State University and their Homelessness Research Action Collaborative. And PSU and Street Roots got together and conducted some surveys where they went out and distributed surveys to the houseless population and asked, what do you want in this new response model? And a lot of the feedback came back mainly to training. They wanted us to be trauma informed and to understand what harm reduction could look like, but then also down to the basics and styles and colors of our uniforms. They wanted us to be identifiable, but not threatening. And so with all that, we took all that information and we presented to council in November of 2019 with huge stakeholder support. City Council approved a $500,000 pilot program, and we were set to launch spring of 2020. COVID happens, and then the killings of George Floyd and other people of color started happening to where it was really coming to the forefront. And that put a lot of pressure on our political parties here in Portland. And really they, with the cry for defunding police and reinvesting in other programs, that message was received well. And during a budget process, they found 4.8 million from the police budget, and they put it into Portland Street Response to grow our team citywide almost immediately. Problem was we hadn't started our pilot yet. So that's kind of one of the struggles that we're having, is recognizing the need for this program, seeing other programs that are successful, to include Denver, Atlanta, Eugene, and really seeing that this is the turning trend. People are really wanting to get this citywide as soon as possible. So I feel like we have a lot of support for that. It's just really trying to be patient as we continue to do the pilot to make sure we're doing it the right way and implementing it the right way. kind of also to Vinny's point, when it comes to measuring the data, when it comes to equity and inclusion, so we don't really understand, or not understand, we don't know who's calling 911. So at the time of dispatch, the demographic on who you're going to isn't always unknown. And then we're finding some of the people in their crisis that there's just really no good way to ask, you know, hey, by the way, what are your demographics, while we're trying to process their crisis with them. And so we're kind of finding a hard way to measure that in real time, but we are trying to incorporate like our follow-up care once we get someone settled for that moment, and get them to the wraparound services, trying to engage a little bit more to get that demographic so that we can measure that. Because right now, a lot of it is just anecdotal, and I do understand the importance of data to make sure that we can get the right funding for the disparities that are out there. I feel like that's probably about the good gist of it for now. Also trying to save some time for some questions. Yeah, I'll just leave it there for now.
Yeah, thanks so much, Trey. I know things are fast moving for you guys over there in Portland, so really appreciate you taking the time to share what's going on. I just wanted to note, we're going to be ending at 3:50, but Jackson is just adding to the chat. My colleague Jackson from Vera is adding a couple of the links that myself, Vinny, and Tremaine have mentioned. We'll also we'll add those to the Whova page afterwards. So I just want to put up our names and contact info again, and just encourage people who are interested in reaching out to any of us to get in touch. Hopefully this works. And yeah, maybe I'll just ask everyone, Denise and Vinny, if you're still there, maybe just in a minute or a sentence, if there's, so we've got a couple of questions that Denise answered that were a little more granular about the program model. So thanks for answering those. Ask our panelists if you have a kind of a call to, maybe a higher level call to action that you'd like the LEPH audience to think of as they watch the rest of this conference. So Denise, if you're there, maybe I'll ask you to go first.
Yeah, I think it's just really important just to have people at the table that look like the individuals who we're representing and we're serving, you know.
Yeah. Thanks so much, Denise. Vinny, any closing takeaways or calls to action for folks here?
Yeah, mine is pretty similar. Just support, fund, and bring the people to the table who are actually doing the work in the community. That's about it.
That's it. Trey.
The above comments as well. For me, I'm also trying to really distinguish between mental health and homelessness. They're not synonymous, and we have to recognize the differences.
Yeah, totally. Thanks for that. Yeah, I hope these are messages that we can all keep in mind for the rest of LEPH. I think the last point that Tremaine mentioned, just like the need for specific and layered approaches in different places, has come through for me in some of the other sessions already. So I think we'll just, we'll probably close it there. And thanks again for everyone. Hopefully you can see our names and contact info over here or on Whova, and please get in touch. And again, for those of us at Vera, hope it was helpful hearing from some of these local programs, and we'd love to connect with others who are doing this work across the country. All right. Thanks so much, everyone.
Thank you.
Thank you very much.